Hello, I am Ulf Pape from Germany. I am a lecturer in innovative massage and physiotherapy, manual therapy and osteopathy. I am currently teaching in Switzerland, Austria and Spain. This clip is about a shelling treatment of the lateral myofascial trains in the context of the lumbar back pain. I refer the fascial model of Thomas Myers, but use my own experience and my own therapeutic creativity. Then we start. Put one leg on the therapy bench as you see it here. Then place the opposite leg of the patient stably on the thigh of your placed leg. Now I bring the patient's legs into the treatment position. Here I show careful potential stretching of the iliopsoas muscle, which should always be treated for back pain. Therefore, on my YouTube channel you can find many tutorials on how you can treat the iliopsoas muscle. For this patient here who is slender and has good mobility, I prefer the positioning with one leg set at right angles. I begin by gently stroking out the muscles between the ribs, continuing toward those of the iliac bone, pulling the lower spine apart. In doing so, I shift my center of gravity in the direction of the pull. When you use the power from your center of gravity, your shoulders and your back can be relaxed. You treat with more dynamic and fluidly. Repeat this treatment maneuver several times. Through this technique, you relieve the lumbar spine and the myofascial structures. In other free tutorials on my YouTube channel you will find more finish-rich relief techniques that are also suitable for less mobile patients. In the next step I stroke out the lateral myofascial train over the lateral upper and lower leg to the insertion of the long fibularis muscle. It is very pleasant when you work simultaneously on the foot with one hand and with the other hand on the body. For example, the treatment of the foot reflex points and acupressure next to the spine can be combined. On the next step, I recommend treating the lateral abdominal muscles, including the muscle regions and insertions with massage techniques. In the insertions and regions areas you should work with slow melting fascial techniques. When treating the muscle bellies you should treat with milling and kneading massage grips. The treatment sequence here, focusing on lateral fascial trains, is not the first when I treat non-specific back pain. First, I treat always intensively the dorsal fascial train according to the model of Thomas Myers, with the focus of the spine, the hamstrings, the calves and the plantar fascias. You can also find a lot about this on my YouTube channel. Very important in the treatment of back pains is the relaxation of the diaphragm. With the hand position you see here, I let my hands suck down under the patient's costal arches with the exhalation. When the hands are sucked in very deeply, you should stay there a few seconds. The diaphragm models the intra-abdominal pressure and holds the spine and the ribs. Therefore, too much tension in the diaphragm causes tension in the myofascial structures and thus on the spine and ribs. The same thing happens the other way around. In the next step, I mold first gently and then deeply into the lateral fascias of the thigh. For this I use also my ulnar. It is important that pull up above the insertions of the iliotibial tract. In the next maneuver, I pull the leg and stretch the iliopsoas muscle a little more intensely. Pay attention to how I fix the foot of the patient's bent leg. If you obey physical laws of lever and center of gravity, the execution is simple and fluid. Now I show a combination of treating the spinal foot reflex points with vertebral acupressure and fascial work. My hand, which is on the foot, performs acupressure on the medial edge of the foot. The fingers cycle 2 to 3 times in one direction and then in the other direction. The other hand presses with the thumb in the same way on the transverse processes of the thoracic and lumbar spine. Sacral foramina are also pressed. The touch is not interrupted as you move from one transverse processes to the other. Your thumb melts deep into the myofascial tissue. Use the law of leverage and work very slowly. Then melt deeply with the thumb into the lateral fascial line of the thigh and fibularis muscles. The fascial traction ends over the insertion of the long fibularis muscle. Therefore, at the end, you should let the maneuver run out over its tendon across the foot. This fascial technique is only indicated here. In the real treatment, you should melt into the fascial line very slowly. The head of the femur can be rotated inwards and outwards via the lever movement on the foot. This causes a small mobilization of the hip joint. Now I use my treatment position to melt into the plantar fascia of the other leg with my fist. The plantar fascia belongs to the dorsal myofascial train. This fascia has a great influence of the balance of the whole dorsal myofascial train from the head to the foot and therefore also on the back. In addition, I can also treat the foot reflex points of the spine of the medial edge of the foot. I integrate sequences from the reflexology into almost every treatment. Try it. Your patients will be impressed. Often the patients have then not only less pain or no pain at all, they feel as well after the treatment as if they had been on vacation for 3 weeks. Stress and pain are interdependent. In addition, I can also use my treatment position to massage the calves. First I massage milling and then kneading. Non-specific back pain is highly complex. Almost regions of the body can be related to back pain. The more complex varied the treatment, the greater the success. The same is true in the physiotherapy with active movement. In the next step, I increase the mobilization of the hip joint and include a little the knee. Again, I use the lures of leverage. I work very mindfully and do not force anything. Always I work with the power of my center of gravity. Breathe deeply and evenly when you treat. Stay in the flow of movement. Then I stroke out the leg and treat reflex point areas of the hip. Also I treat acupuncture points in this region which can help with back pain. I will not go into the detail about this now. That would be too much at once. What I want to teach in this tutorial is therapeutic creativity. I want to motivate you to vary and combine. Use not only your knowledge and experience. Use your fantasy as well. Design your treatment autonomously. But also exchange creatively with your colleagues. A good therapist is also an artist. I recommend you brainstorming with your colleagues and partners. Develop your own techniques on the assisting ones. Learn less depending on teachers. Become your own teacher. Regarding this tutorial, I recommend you to learn step by step. Also, I recommend integrating your own therapeutic ideas into the execution. Now, stroke out once more briefly and place the upper arm of the opposite side in extension. The latissimus dorsi muscle and the teres major is in pre-stretch. Repeat some techniques in this position. At the end, place the patient in the normal prone position and stroke out the whole body. Then treat the other side. If you like this tutorial, please subscribe my channel. Thank you for your attention.